Hello, this is David Kettlewell, and welcome to Medical Matters, because life matters. We're going to be talking today about immigrants and refugees from the healthcare perspective. It's a great show. Thanks for joining us. Hello, and I'd like to introduce you to our guests in the show. We have Pamela Keffey, and you are the Executive Director with the International Institute of Buffalo. And we have May Shogun, and you are the Director of Education for the International Institute of Buffalo. And we have Marlene Schillinger, who is the President CEO of Jewish Family Service of Buffalo and Erie County. And before we get into immigrants and refugees from a healthcare perspective, we must introduce Jewish Family Service.
Well, Jewish Family Service is a community-based, not-for-profit organization that serves people from all ages and all backgrounds. We have a licensed mental health facility. We do vocational counseling, immigrant and refugee resettlement, and we do it, immigrant and refugee resettlement, in relation and in partnership with International Institute and two other agencies, Catholic Charities and Journey's End. So,
before we enter the world of discussion of immigrants and refugees from a healthcare perspective and their healthcare challenges, let's just deal with one question quickly. I've read some editorials in the newspaper, didn't like the sound of them much, but people are saying we have enough Americans, don't let any other people into this country. Why is that thinking totally bogus?
Pam?
Pam.
We've been working with refugees and immigrants since 1918, and we've been able to see that immigrants are very strong contributors to our economy. Most people who come to this country as immigrants are able to become homeowners and successful in our communities. So it's really a myth that immigrants are a drain on the system. And we just think that they bring an awful lot of talent and culture and amazing contributions to our country.
Right.
I agree with that, and I think also that's basically what America's all about, and it's what makes it unique. You have different skills, different backgrounds, and it just adds to the what America can offer and all the talents that it can offer. And also, even when they come here and they're struggling to adjust, it doesn't take long because they come with a dream, and this is the land of opportunity. So it doesn't take them long to work hard to achieve that dream.
And at the end of the day, most of us came from somewhere.
Exactly.
I mean, Jewish Family Services' roots were in resettlement. We were bringing people over since 1862 from Europe. And so all of us, at some point, came from somewhere. And that's what makes us great.
And chances are the people who are saying those things are the children of the people that were resettled by our agencies 50, 60 years ago.
We're in Buffalo, New York today.
Yes.
A lot of immigrants, a lot of refugees, and they have health care challenges.
Yes.
What are those challenges?
Well, I think the first challenge, just to getting good quality health care, is having people have an understanding of what the culture is, what people's language needs are, and being able to explain what their needs are, the immigrants and refugees' needs are, and they are in some cases different from ours.
One thing that's unfortunately true is that some of the refugees have been tortured and abused in the countries from which they sought asylum.
Absolutely.
That's a tough story.
It's a very tough story.
There's a big need for that, and especially because a lot of refugees who have who have been exposed to trauma, to them, they don't address it as a priority. They have so many adjustment issues to deal with, and to them, even the concept of counseling is new, and the way they express their mental illness symptoms is usually in a physical way. So it makes it harder, but they put it on the back burner. They don't really address it as mental issues, and because of the things they've been through and the trauma they've been through, there's always some need for some counseling for them and addressing the mental aspect of the their health situation.
Well, this brings up who's a refugee, and what's the process by which somebody who's a refugee can get into this country?
Want to take that one?
Yeah.
Legally.
Yes.
Legally.
Refugees are people who are fleeing persecution in their home country, usually for reasons of race, religion, ethnicity, membership in a political party. And the UN is the body that would identify somebody overseas as a refugee. So the first hurdle for a refugee outside of their home country is to present themselves to the UN. They'll generally end up living in a refugee camp someplace. And before they come to the US, they have to go through a series of screenings to make sure that they are healthy enough to come to the US and that they pass our Homeland Security clearance checks. So there's many hurdles for them to go through before they come. Congress establishes a number of refugees that can come to the US every year. It's generally hovering in the area of about 65 to 70,000 a year. And then they're brought here through a very structured government-sponsored resettlement program.
I hate to say this, but there's also an undercurrent in American society that, gee, if people make it into the United States, I mean, should they be receiving a bunch of free services? You know, let's address that. Now, you have somebody that comes in as a refugee. Why is it important for them to get some medical help?
Well, first of all, I'm not so sure it's free service. People are coming in here and they're legally being accepted into this country. So with that, they have certain rights, and they have rights of every other citizen. It just makes good, plain sense to have healthy people entering the country, and then the healthier they are, the better off, the better able they are to contribute.
So really, helping immigrants with medical issues is investing in America's future.
Absolutely.
Is how you would view it.
Absolutely.
Because for them to be self-sufficient and to work, they need to be healthy.
Right. How does post-traumatic stress syndrome, and we'll have to explain what that is, but I'd like to know how that impacts somebody's health a little bit, and what is PTSD?
PTSD is trauma, and it exhibits itself in a number of different ways. In kids, young kids coming in, it could be nightmares. It could be certain types of phobias. It could be acting out behavior. I mean, people are going to behave in ways in which they've seen sometimes. And the people that we see, many of them have been through horrendous situations. We have children who've seen their relatives beaten and actually killed. So I think it exhibits in different ways, it presents in different ways, and also it's not a constant presentation.
If you could, share a multiplicity of stories about individuals, no names, just this individual had this happen and they came here, so that our audience says, I'm starting to get a grasp for who finds their way to this country. What are some examples of refugees?
Some examples that I can think of might be a Somali family who had to leave their village and walk for several days in very difficult situation. We've heard stories of clients who had to climb up
because that tribe was being totally massacred by the power
for example,
that be.
Yes.
I mean, they didn't go for a walk. They were
they left their
escaping
village
to save their lives.
They were fleeing militants who were out to kill them. Okay, so in the middle of the night, the mother will grab her babies and children and run into the bush, and then have to flee towards the border where she believes she can find safety. And along the way, she and her children have to climb into a tree at night to hide from the lions. So
these things are
constant
real.
fear.
And
Absolutely.
I have a friend who told me this story, and I've always remembered it. It was the story of Babi Yar in Russia. The German army was moving quickly in Operation Barbarossa at the beginning of World War II through Russia with the goal of wiping out the whole country. And it was true that there was a lot of conflict between the Russian people and the government prior to the Germans coming in. So a lot of the Russians felt this could be a good thing. Germans were coming in to one town, Babi Yar. A gentleman I know named Roman had his family, and he was married to a woman. He had a brother, and they had mother and father, and there was a discussion at the dinner table. Should they stay and welcome the Germans or get out? For more Medical Matters television shows, go online to medicalmatters.tv.